Hi everyone, welcome to Postnatal Minds, the podcast. This is episode 6, and today I'm joined by Levi, who is the Mummy Physio, who is a specialist pelvic health physiotherapist. And we met recently, and we both kind of launched our business at similar times, didn't we? I think we were a
Yeah,
little bit ahead,
yeah,
so it's been really nice to have that person to experience
yeah. Chat
alongside.
about everything.
Yeah, so thanks so much for coming on today.
No worries. Thanks for having me.
And yeah, do you want to just tell everyone a little bit about what the Mummy Physio is?
So, the Mummy Physio is a specialist pelvic health physio company in Brighton and Hove. So, I mainly see mums when they're pregnant and postnatal, and I have a home visit service. So, I can see people from straight away when they've had a baby. That might be a few weeks after, and it can be up to years after. And then I have a base at Montefiore in Hove. So, that's my main specialty. Yeah, it's a new company, but we're doing really well. And yeah, it's an exciting time.
Yeah, it's exciting. And how did you first get, because you're a physio by trade, aren't you? So where did your journey begin with that, and how did you get to where you are now?
Yeah, so I qualified from Brighton just under 10 years ago and did regular physio training. So 3 years straight from A levels, and then went and became a physio in the NHS and did that for in the NHS for 7 years, but always worked a bit privately. And so mainly worked with musculoskeletal problems. So joints, like bones, muscles, like what you think of as like a generic normal physio. And then I started doing bits of Pilates and teaching Pilates. And that's how I started to see women that were pregnant. And as a physio, I was actually just scared of pregnant women. I just didn't know how to treat them. I was like, oh my God, they're pregnant. I don't want to see them. I have no idea what to do. And then I got a training post in the NHS. And that's where I really started to learn, because they put you on all the competencies. And then I did that for a few years. And then, yeah, just been treating mainly postnatal and yeah, women with pelvic floor problems ever since.
Yeah, it's so true what you were saying about feeling scared, because I feel like particularly in the UK, people are like, if you're pregnant, oh no, we can't treat you, we can't treat you. It's like massages, it's like everything like that. And I remember
Yeah.
I was trying out the local, shout out to Saunadelic, the lagoon, you know what I mean, the sauna at the lagoon.
Yeah.
She was saying that it's the way of life where they live, and children go in it, and pregnant women all throughout their pregnancy use a sauna, and it really made me think we live in such a cautious country in that sense. And I'd never heard of pelvic
No.
physio until I've got a friend that's a physio, and in our NCT group they definitely access, and some people definitely went for the mummy MOTs, but yeah, it feels like a really new thing, but it's not a new thing, if you know what I mean, in
No.
terms of the presence of it, right?
No, it's not new. But for instance, my mentors in the NHS, some of them have retired now, but say they're in their 60s, they would have been some of the first physios that were doing this kind of physio. Physios have existed for much longer than that, but it's still not really talked about. We in the Chartered Society of Physio, they're we get a monthly kind of update and stuff, and it's always about women's health is at the back with one page, and everything else is got 10 pages, and it's been like that. We're getting a lot better, and Mummy MOT was obviously trademarked, and that's made women and celebrities have obviously endorsed that to be go and get checked, but it's taking that influencer, all of that kind of stuff, for people to realize oh, I actually need to look after myself after having a
Yeah.
baby, and not just all that focus being just on baby.
Yeah, it's not just a nice to have, it's a must have. And so
Mm.
to help people kind of understand what it is that, what would a consultation with you look like?
So it depends what you're coming from and what you're coming for, but for the postnatal, mummy MOT kind of postnatal check, we would talk about anything that you did before having baby. So talk about all of your exercise, your normal exercise, your goals of that, what you want to get back to. Then for the assessment, we would talk about your birth and talk about any interventions, and then we go through everything about how you're feeling now. So we would do an assessment mainly of your actual outside of your pelvis, and then if you consent to it, we would have a look at the internal muscles. So the pelvic floor is obviously all an internal structure, and if you've given birth vaginally, then that should be checked for prolapse and to make sure that you're doing the exercises correctly. And then we would send you home with a rehab program.
And typical nurse wanting the gory
Go for it.
details, but how do you internally inspect? How do you internally expect?
I'll show you. I'll get the pelvic. I'm just thinking, I've got one here. I'll send in my clinic. So
because I definitely do like pelvic floor exercises, but I don't have a clue if I'm doing it right. Oh yes, I'm such a visual learner.
Yeah.
Give it to me.
So your pelvic floor is from like your pubic bone to your coccyx. So the best way to think about it is like a hammock and a bowl. Where obviously it's all connected to your abdominals, right? But that's the best way to think about it. So when we assess, obviously it's all consensual. So you don't have to have an internal assessment, but that's the gold standard. So for the internal, we would have a look at the vaginal entrance, and then I would get you to push down, and then we would look for any descent. So if we could see the bladder or the bowel, if it's like a grade 2, you'd be able to see it. If not, then we would do an internal assessment, and we would do that anyway to look at the pelvic floor, where we kind of put one glove finger into the vagina there, and then we feel onto the muscle there, and then get you to squeeze. And if you're doing it properly, the finger should lift and it should go up towards your head, yeah? So your pelvic floor is like that kind of squeezing motion. But lots of people once have had a baby, because of either the size of the baby, episiotomy, anything like that, those tissues are torn and they don't always come back, and people can squeeze the pelvic floor all day, but they can't see it. So when you tell your bicep to like squeeze, you can look at it, right? But because you can't see this is why it's like quite important to get it checked properly. And then you might never need an internal assessment again, but that first one can be quite good.
Yeah, so interesting. So what are most of the people that you see people that have had episiotomies and tears, or is it more important if that's been your experience, or is it just as important if you've had like, a planned C-section, or who do you see the most?
So I probably see a mix of like cesarean and vaginal births, but we will tend to see people more after they've had an intervention, an episiotomy or a tear. But people still have problems even if they don't have that, and then they won't necessarily get the same amount of care if you haven't had a 3rd degree tear. So the NHS would always follow you up and see you for that kind of thing. If you have a 2nd degree tear, very much like, on your way, self-manage, do the pelvic floor. So privately, I see a mix of things, because some people are just really active and they want to get back to things, and they'll just come in and they don't have any problems, they just want reassurance. And then we will see people with like significant prolapse that we need to get checked, and we need a consultant as well. We see everything.
So do you think in an ideal world every woman should have that checked as a baseline minimum, no matter what your birth was?
Yeah, I would say if you're happy with it, I would say just getting that baseline at some point postnatally, and that is forever. So people might wait years until they feel ready, and depending on what's going on in their life, it might be for a while. But if you want to get back to exercise, or you want to feel that you can do all the things you want to do, then coming as early as you feel comfortable is good.
Yeah. And is it more advantageous to do it earlier? Like if you come years on, are there things that you could have done straight before that
Yeah. So like the other thing, so definitely for the pelvic floor, early intervention is best. If it's left, it's harder to get it back. It's not a complete no-go. Like people don't come in for years, we still can get them better, but it would take longer. It's like anything, if you don't use it, you lose it, right? So, and the other thing is like the abdominal separation that you can get, that's, if you treat that early, the outcomes are a lot better. Whereas if the tissues are left for longer, then the healing is already taken place. It's much quicker in that first like 12 weeks to try and rehab.
Oh, really? I didn't know that. So I'm already part of that statistic then, because I definitely had that. What's it called? The when you separate?
Diastasis recti.
Diastasis recti. Yeah, because I had extra fluid with Arlo. My stomach was huge. Polyhydramnios. That's what it's called, isn't it? Yeah. My abs now, like my whole, I swear my whole rib cage has moved, because I always feel like no matter how my weight fluctuated, my little waist
Mm.
was always like something I could home in on. And now
Yeah.
it's like my whole upper body feels so different. And I'm like
Yeah.
just going back to like running and exercise, but I mean, Arlo's like a year, nearly, what is he now, 16 months. I still feel really vulnerable
Mm.
in the gym, and I don't have like, you know, leaking or anything like that, but I
No.
definitely feel that disconnect between I really have to think about engaging my abs now. And like when I'm
Yeah,
in
abdominals.
Pilates, I really noticed like my lower back taking things on. And I really have to
Mm.
think about that engagement after the 2 C-sections.
Yeah, it's definitely one of those things. And I think especially with a C-section, you're not always given that much information with it. So you're just kind of told to just like get on. And if you had a shoulder surgery or anything else, you would have a physio, you would have someone to talk about it with. Whereas the cesarean, it's very much like check the stitches, right? That's it. You can exercise from 6 weeks
Yeah.
and off you go.
That 6 weeks,
It's
that six
crazy.
weeks thing, I've talked about this before, but I've never heard such an insane thing in my life. Like,
No.
give yourself at least 6 months, forget 6 weeks, give yourself 1 year, like literally 1 year.
Yeah.
Yeah, when I had my first C-section, I was so shocked at the culture that existed of people being like, you know, it being the easy way out, or, you know, too posh to push. There was that whole thing, wasn't there? And I
Mm,
really
mm,
wanted a natural birth actually, and I didn't get it, but you know, that's fine.
mm.
But yeah, I found the recovery so hard, and I was in lockdown, like just at home
Yeah,
without
it's a
much to
lot.
do, but I was so overwhelmed by the pain and the healing. And the second time round, I was so busy worrying about other things. I said
Mm,
to myself I want to take it more easy, but I definitely still didn't really like look at my body for a good. I think the first time I properly looked at my body was when I did Pilates. I went to Bring Your Baby at Kin Pilates
mm.
in
Oh
Hovelooking.
yeah.
She's
Yeah.
great. But and I remember going to the consultation with her and looking down. It was like the first time I'd looked at my tummy, laid down, and it was all like
Yeah.
textured and wrinkly. And I remember thinking, oh my God, like this is the first time I'm thinking about it, because I disconnected
Yeah.
mental and physically. I just totally disconnected the two. And I guess there's something there,
Yeah.
isn't there, for like what you and I are working towards is bringing those
Mm,
together, because like your line of work, mental health is also not really adhered to after
mm.
for women as well.
Yeah, it's definitely, I definitely feel that. We just don't give enough education and support, I think. So yeah, having these other options to tap into is really important for new mums.
And do you find that women that come to you probably have trauma and mental health kind of
Yeah.
experiences, or things going on that, you know, they might not, and vice, I guess, that way around for me as well. Like they are so connected in that sense, aren't they?
Yeah. And what we know about pain and mental health is, there's such a strong connection between both of those, where even, for instance, pelvic girdle pain in pregnancy. Did you have that in your pregnancy
No,
or
that's
not?
the
No,
one
you
thing I
didn't.
didn't have.
Yeah, I know you had quite a few things, didn't you? But like pelvic girdle pain, a lot of that also is because the tissues become very sensitive. And pregnancy is like one of the most stressful times because you've got all these other things to think about. And that can have a knock on the nervous system. So we know that the pelvis does not move. It doesn't, this relaxing does not cause all this pain. It's all the other stuff as well. So the mechanics, but the actual psychological input. And then when people think, oh, I'm going to end up in a wheelchair, I'm going to end up with all these things, that creates fear. And then
Anxiety.
the pain gets anxiety, and then the pain gets worse. But we're not telling people this is all in your head. That's not what we're doing. And I'd never want someone to think, oh, you're going to come in and that's what you're going to be told. But it's getting that understanding of all the other things that can tap into your nervous system, breath work, tapping, speaking to someone. And
Yeah.
that is just quite often what we end up doing in physio alongside. And that's why it's good to have other people you can refer to and have more professional input for that.
Yeah, because some people can get pelvic girdle pain quite early on, and presumably that would then feed into their readiness and calmness and
Mm,
oxytocin levels for birth, and could potentially lead to a
yeah.
more instrumental birth if they're not relaxed, I guess.
Yeah, totally that. We find that I say to a lot of people when they come in with, like, for instance, that kind of pain, it shouldn't affect your birth. But obviously, if you have this for 30 weeks, like you've had it from the whole start, you're going to be exhausted. You're going to have, you're going to feel really low and you're not going to feel confident for that. So,
Yeah.
again, for that, like when you start feeling bits of pain, coming in and seeing us and getting that reassurance rather than just putting up with those kinds of things. And, most of the time the pain should go straight after having a baby, which is what people say. But we do see the odd person that will suffer with their pelvis after. And that shows you that it's not always just to do with, the relaxing or that period. It's everything else after as well.
Yeah, well, like bones move, don't they, when you're like everything
Yeah.
relaxes and some things. So there's bound
Yeah.
to be that after. So
Yeah.
how many sessions do people normally kind of need with you as part of your service? Like what's normal?
Yeah, so I mean, it really depends. Some people we see once and we never see again because they manage well. They've just come in because they need reassurance to get them back to, for instance, like some gentle exercise. But on average, we'd normally see someone after having a baby once for assessment for mummy MOT, and then after that assessment, we would normally do like 2, 3 sessions, depending on what kind of birth you've had. If you had quite a lot of interventions and the pelvic floor is like not working at all, that's probably going to take 6 months of treatment. Doesn't mean we're going to see you every week for 6 months. Normally do follow-ups every 3 weeks or so if it's something with the pelvic floor. If it's something with your abdominals, every 2 weeks or so to kind of progress you. So on average, I'd say it's an assessment plus 3 treatments, and you should be at that point of going back. If you're a triathlete, that might take us longer, but on average, if you're going to be doing a bit of running, a bit of exercise, that should be enough.
So really women can come to you like as soon as after birth. I know they can come to you obviously prenatally as well, but after birth you can see people
Mm.
as soon as they can.
Yeah, as soon as possible, really. I mean, 6 weeks is what we normally say to just have that healing, whether it's a cesarean or a vaginal delivery. 6 weeks to like heal, and then we can do the assessments. I do say to people, if they are really struggling, we can come before, and you can come in before. It's not a problem. It's just that, if you've had stitches, for instance, you don't want to be creating, likelihood of infection and things like that. But if you've got
Yeah.
a concern about something, come in before. It's fine.
Yeah. Are there any cases in your career that like stick in your head? Because I know there is as a mental health nurse. I look back and there are certain things I really remember, or like things that I'm particularly proud of that I did.
Mm.
Like what is it that keeps you going? Are there particular things that you think, oh, that's why I did what I did?
Yeah, I think a lot of the time with this business and why I'm so passionate about it is that people come into me and they can't even look at their bodies when they first come in. Like, for instance, I had someone with a cesarean scar that literally hadn't even touched it when she came to me. And then by the time she left 4 months after, she's running the half marathon this year. So within 6 months, and they say like, I feel like a complete different person. That's that's what I wanted to feel as a physio, and that's why I went into pelvic health, because in loads of the other types of physio you just don't get that feeling. People just, they want surgery, they don't always improve, and they just kind of like float off your list, and you don't get the same reward. So yeah, that's what keeps me going, those ones.
Yeah, that was me. I genuinely didn't. I totally detached from my scar. And you meant, there's so many things you can do for scars as well, aren't there, with scar
Yeah.
massage and yeah, that's a whole other
Yeah.
thing, isn't it?
That isn't really discussed, right? They just sort of say off you go.
Yeah,
And we are, like, I'd say, as pelvic health and like women's health physios, it's just a completely different world of we see everything. So like all of the things that you've never talked to anyone about, we've probably spoke about it all day. So yeah,
yeah,
and anything we can pretty much talk about with the pelvis within our scope.
yeah. And that's why, you're keen to raise awareness and get, these services out there. And what's like that we've talked about like the advantages of women coming to you, but what
Mm.
what happens if they don't? Like what are the disadvantages of not seeking help with some of the main problems that people come to you with?
Yeah, I mean, if you don't come at all, sometimes you'll be absolutely fine. you'll have no problems. We are strong as women. We're meant to birth babies. You should be okay in most instances. If it's left, then you have a higher risk of having things like prolapse in your or in the menopause, where your estrogen levels will drop, and that's when symptoms start to occur. So that's some of the things. If you might start suffering like pain if you don't have a proper assessment and don't get your strength back in your core and in your pelvic floor. And then people can just start getting pelvic floor symptoms. Like some people come in like 10 years later and they're like, I had a really traumatic birth and I was never assessed. And then they're coming to see me for like stress incontinence. Something like stress incontinence is just, there's too much pressure for your urethra, so your pelvic floor isn't strong enough. A lot of the time that can be cured with physio. Doesn't need any intervention.
Yeah, I was going to say to you, because obviously a bit like what I do, the obvious client group is for those straight after birth. But do you see, are your services open to people who are like a lot further down the line? Because I always say
Yeah.
with postnatal minds, like in my eyes, that postnatal period never ends as a mum or a dad. But
Yeah.
do you see people like you just said further down the line who probably could
Yeah.
have.
All the way. Yeah. So, I mean, my main client group is mums, but also I still probably see 50% of my week as women and men, like in their later lives. So I still work as a musculoskeletal physio as well. So if you've got shoulder pain and all that kind of thing, I can treat. But yeah, I see a lot of people in the menopause or post-menopause that have had surgery. So, I'm looking at the outcomes of what might be people 30 years from when they're sat in my room. So yeah, there's a good thing in like just getting it done early, so you have that education as well. And I think knowledge is power, definitely with this kind of thing.
Yeah, it's like I say with mental health, like we do so much prep for our birth and that bit, and really we don't
Yeah.
put enough time or effort into thinking about this postnatal bit with all the
Mm,
like the whole fourth trimester. Like we need to focus on planning for that and what we've just held a child for up to 10 months. Like what's your plan then to heal from that and assist your body and your
yeah.
mental health to recover from that
Yeah.
100%.
Yeah.
So I've got to admit, I do try and do pelvic floor exercises. My mum's definitely got an app on her phone that reminds her, but I mean, I'm not great at doing them. And sometimes when I'm doing Pilates, they're like, pull your pelvic floor. And then I feel like I should be pulling it up when I'm meant to be pulling it down. Like it's a
Yeah.
weird, really weird one. So I'm sure there are many women out there feeling like I do. So can you tell us how to do the best pelvic floor exercises and how we
Yeah.
know we're doing them right?
Okay. Yeah, this is a great question because it's so common. And even as a physio, we would sometimes say, are you doing your pelvic floor if they're seeing this for something else? And you need to really make sure people know what that is. So the best cue is on the pelvis here. So the best cue is to think about holding wind and holding wee. A lot of people do the front bit, they don't always do the back. But like I showed you at the start, the pelvic floor is like that hammock and that bowl. So if you don't get the back passage, you won't get the full squeeze. And a lot of the time people are just doing the front, and if you've given birth, you can see that a lot more of the muscles are around here. So that's what we need to create the lift. So that's how you would do it. So you would kind of hold both as much as you can and then let go. And then you would practice that because it's like your muscles have got like a sprinter muscle and then like a marathon endurance. So slow and fast twitches. So you need them to work, one, to hold the urine and hold your bowel as well, so you remain continent. And the other thing is when you jump on a trampoline, you need them to squeeze quickly. So that's
Okay.
why it's good to practice the quick ones for like those coughs, those sneezes, the jumping on the trampoline, which you absolutely should be able to still do. And then the long ones are for more that continence. And to know if you're doing them correctly, one is obviously come and see us, but obviously if that's not something that you want to do straight away, that's fine. The other thing is to literally look. So, you don't look at your muscles. So put a mirror at the end of the bed, lay on your back and have a look to see if you can see the back passage and the front actually squeezing. That will tell you. And the other thing that people can do is sometimes just get a towel and roll that up and sit on it. And if you're squeezing it, you'll feel the muscles squeezing a bit more. They're some of the basic ways to know, because you cannot know any other way. Like doing a squat, if you're doing it with things like that, you're just not going to know if it's working. So that's
No.
the best way.
Really good tips. I feel like these things should also be taught when we're younger as well.
Oh
Like I remember
yeah,
getting
for
like
sure.
one lesson of what was it called? PS,
Oh,
personal
PSHE.
social health education. Like one lesson, and that's like mostly what I remember from school.
Really?
You need to be careful if you like with the mirror, especially if you've got children. They'd be like, "What are
Yeah.
you doing, mum?" But no, they're
Yeah, I know.
really good tips.
Yeah.
And
Yeah, for sure.
how little can we get away with doing them? Like, what's the ideal number?
So the ideal is you should be able to do it 3 times. You should be doing it 3 times a day, especially in pregnancy. But then
Really?
moving forward, as long as you do them kind of once a day, you should get enough benefit from that. So the 10 seconds 10 times and the 10 quick.
I wonder if there's anyone in the world that actually does them that well and often and
I
thoroughly.
know.
I mean, I'm
But
shambolic.
like, it's really hard. And we want them to be intentional. So doing them like at the traffic lights, like that can be enough if you really know what you're doing. It's not enough if it's new to you. It's like anything. It's like going to the kettle and just like doing a few bicep curls. You're just not going to see the benefit. You need to go do a proper program.
Yeah.
If you have symptoms, you need to be doing them properly. And the apps, there's apps that are really good. So Squeezy app is an NHS app. That is what we tell a lot of people to get, and it'll come up on your phone, it'll run you through it, and that can really help adherence to them.
That's good. So if someone's had an episiotomy, do they, and I mean, I know loads of people that have had them. I've got a friend who actually just opted to have a C-section because of her episiotomy last time and the healing.
Yeah.
Are you more likely to have kind of pelvic floor issues, presumably because you've that's a main part of that structural muscle that you just shown us, or?
Well, not necessarily, because if the episiotomy might stop a 3rd-degree tear or a 4th-degree tear. So they're normally doing the episiotomy as a preventative
Okay.
measure, right? So if the baby's head is particularly big or it's just you're a bit stuck, then it doesn't necessarily mean that. We tend to find the worst outcomes are with forceps deliveries.
Right.
So that's where we have to, we should be checking people with interventions because the pelvic floor can be affected from them.
Okay. Yeah, I mean, I'm two C-section down, so I'm not like too familiar with all of those
Yeah,
interventions. I guess part of the reason I chose to have a C-section was my fear of ending up in a situation with kind of
yeah,
forceps or an episiotomy, and some poor friends' experiences where they've had to sit on, donut cushions and barely even been able to sit down, let alone think about their pelvic health.
yeah,
Um,
yeah.
so how would are your sessions the same dependent on whether you do them at home or in your clinics?
Yeah, so the sessions are the same. Pretty much everything I can do in the clinic, I can do at home. Duration, like you'll get a good hour for your initial, and then I tend to do hour follow-ups at home and then 45-minute follow-ups in the clinic. The other thing that I do offer in the clinic is a pessary service. So a device, if you do have prolapse incontinence, I can fit a silicone pessary, which you would put in and you could take in and out, and that can help you get rid of your symptoms without surgery sometimes. So
Oh,
that's
really?
the difference. Yeah.
And how does that work?
So that's just something that we would measure. We would do an internal assessment, see what the prolapse is like, and then we basically just size it, and then I'd fit you with it and see how you get on, and then you'd be taught how to take it in and out yourself. And it's one of those things that people, again, they just don't really talk about. GPs kind of just will put you on a waiting list to gynecologists maybe for a year, when there's loads of things that we can do that are literally quite small interventions. I mean, it's obviously an advanced clinical skill, but it can just be as effective as having surgery.
So do you find that people are starting to come to you because there are longer waits in the NHS? Yeah.
Yeah, yeah. A lot of other physios refer to me for that as well. But yeah, in the NHS, you'd have to wait maybe a year for a routine gynecological assessment. And we know nationally, women are waiting for years to see a gynecologist. So, if there's other little things that you have not tried, physio is likely to help you if you have mild to moderate symptoms, is not a severe prolapse, for instance. And the same with incontinence. If you have anything and you haven't seen physio, it's definitely worth trying.
Yeah, because you presumably the time that you're then waiting to see a gynecologist, your prognosis is going to be potentially worse the
Yeah,
longer you wait around.
worse, and just feel, fed up with it by the time you get there. And like a lot, we're obviously following evidence base and nice guidelines, and say you're going to have a prolapse repair, you should always had 3 months of physio before that. So it
Oh,
might be that you
really?
you might go see a gynecologist, and they might say, right, I don't want to operate on you yet because I want you to see if physio will work. And that's when people can get a bit annoyed because they're thinking, oh, well, I could have seen a physio a year ago. So if you've already done that bit and you've done the conservative bit, then the surgeons can know, right, I'm going to operate on this woman and she's tried everything else before I go and do intervention. Because again, surgery might not last, it might not work.
Yeah.
So they want to make sure, they also want to help you, yeah.
So do you sometimes get people coming to you because they think it's like a tick box stepping stone to getting surgery, but actually then they find that your interventions really help and it actually, they might not even need that surgery, as you
Yeah.
said.
Yeah, like a lot of people that consultants, because I have good relationship with the consultants here in Hove, a lot of them that send patients to me, some of them are kind of like, oh, what's a physio going to do? And then once they've done 3 months of it, they're like, I'm not leaking. I don't really feel the prolapse. Like, I'm not going to go back to the consultant for now. I'm just going to manage with this. So yeah, obviously that's not with everyone, but it's definitely worth trying.
And is that the biggest symptom that you think people come to you with when they realise when they're jumping on trampolines or they're starting to run, or because the leaking's a really obvious physical sensation, isn't
Yeah.
it?
Yeah, I'd say leaking, like incontinence, stress incontinence. But we also get people with like an overactive bladder, which we can help with. So rushing to go to the toilet and then prolapse. But literally, I see such a mix of things. It could be, and you could have all of them,
Yeah,
that's the thing
yeah.
at once.
So that assessment is really important for you to
Yeah,
explore. And I guess what you're saying is each person will have a bespoke plan with you after they've seen you
yeah.
to kind of, yeah, because everyone's different and every birth is different and everyone's body's different, presumably, yeah.
Yeah, and some of the symptoms they might have had before they gave birth. So you might have had an overactive bladder for years, that
Yeah.
where you literally like, people you go on a night out with them and they're going, they go to the toilet every like half an hour, like, so they know that when they drink these things, it aggravates their bladder and it's very irritable already. So yeah, I think, we have an hour as well, and a bit like your service, you're giving people time, and there's not many services out there that give people an hour to talk about their
So
problems.
true.
When you go
Yeah.
to see a consultant, you're quite often going to have 10 to 15 minutes with them, and they're going to cost more than seeing a professional,
Yeah.
and the time is so needed to talk about it.
100%. And even these GP, I say the same about the 6 week follow-ups as
Yeah.
well, because and I know there'll be so many women that goes to those and want and need to talk more, but they know that they've only got a 10-minute appointment. And, we, again, there's that cultural thing, isn't there, of like, oh, I don't want to take up your time, doctor, and all of that. But
Yeah.
it's about us working to normalise
Yeah.
that input and the need for it, and not actually making people feel isolated and like it's a luxury to have your
Yeah.
mental health and your pelvic health or your body kind of looked after you've just grown and birthed a human. Like as you say it,
For
it
sure.
just, yeah, it's mad. So
Yeah.
yeah, I think it's so important what you're doing. And yeah, I know we are going to keep in touch, and I'm sure we'll
Yeah.
have, clients that overlap as
For
well because they
sure.
come hand in hand. And if anyone hasn't already seen, Postnatal Minds and Mummy Physio have got a competition giveaway running in, I think we're announcing it on Christmas Eve, aren't we? So
Yeah.
there's a few,
Coming up.
yeah, a few more. By the time this is published. There's still probably a few more days to get your chance to win a consultation with both of us. So perfect package, as we've said, if you're pregnant or, you know, just given birth, or you're years ahead and you think, oh my God, I need to talk about everything and need to get checked and there's still things that aren't right. So yeah, be sure to enter. Thank you so much for
Thank
coming on
you.
and telling us about what you're doing, and keep up the amazing work. And
Amazing.
I will see you very soon.
Yeah. Thank you so
Thanks so
much.
much. Bye.
Bye.